Welcome to today's Explainer. We're diving straight into a condition that is incredibly common, yet sneaky because it's often completely silent in its early stages. We're talking about chronic kidney disease, or CKD. Now, a lot of people walking around with underlying CKD honestly have no idea they even have it. That's exactly why we designed this Explainer, to be a truly useful patient information tool that puts the power back in your hands. And look, I want to kick things off with a massive dose of hope. The way we treat kidney disease has genuinely transformed over the last few years. It's gone from a condition where doctors mostly just watched and waited to one where you can actually be an empowered, active participant in protecting your health. Okay, let's get into it. To keep us on track, here's a quick look at our roadmap for today. 1, the silent kidney condition. 2, the 2 tests to stage CKD. 3, when to use ultrasound. 4, the 3 treatment pillars. And 5, monitoring your health. Basically, our goal today is to totally demystify this disease. We'll break down the specific tests your doctor uses and reveal the modern, super effective treatments available right now. All right, Section 1, the silent kidney condition, and why you might not feel it. Here's the truth about early CKD. Most people feel completely 100% fine. You generally don't see any symptoms at all until your kidney function has dropped pretty significantly. And that silent nature, that's exactly why this stat is so wild. 10%. 1 in 10 adults is affected by chronic kidney disease. That is a massive number of people, and your risk goes up pretty steeply as you get older. Because it sneaks up on you without any obvious symptoms, you can't just wait around until you feel sick. Proactive screening is absolutely vital, especially if you fall into any high-risk categories. If you have diabetes, high blood pressure, any history of cardiovascular disease, or if kidney issues just run in your family, you need to actively look for it. Getting screened could literally be a lifesaver. Which brings us to Section 2, 2 tests to stage CKD, the G and A stages. Now, medically speaking, CKD means you have reduced kidney function or kidney damage that's been hanging around for 3 months or more. But to really figure out what's going on, doctors actually need 2 totally different tests. It's like a puzzle. You need both pieces to see the whole picture. First, there's the eGFR. That's a blood test. It calculates your G stage, from G1, which is great, down to G5. Basically, it estimates how well your kidneys are working as a filtering engine. Then, you've got the ACR. This one is a simple urine test. It calculates your A stage, from A1 to A3, by checking for albumin. Albumin is a protein, so this test is basically checking to see if your kidneys are leaking. Healthy kidneys really shouldn't let much protein slip through the cracks. Put those 2 together, the engine's filtering capacity from the blood test, and the leakage check from the urine test, and your doctor gets a complete picture of your kidney health. And honestly, this is a massively important point. Doctors will tell you that the ACR result increasingly drives a huge chunk of their treatment decisions. A lot of patients are surprised that a simple urine test is so critical, but here's the kicker. It can actually reveal abnormal damage, that protein leakage, even when your eGFR blood test still looks perfectly normal. That's exactly why you absolutely have to get both tests. Okay, moving right along to Section 3, when to use ultrasound, and looking at the structure. A lot of times, a kidney diagnosis makes people anxious that they immediately need to go get a structural scan, like a renal ultrasound. But actually, scratch that. Not everyone with CKD needs one. Doctors really only reserve ultrasound scans for very specific red flag situations. We're talking things like an unusually rapid drop in your kidney function, or if there's visible or detected blood in your urine. They'll also use it if you have symptoms of a urinary tract blockage, a family history of polycystic kidney disease, or if your CKD is already in an advanced stage, like 4 or 5. Basically, blood tests tell us how the kidney is functioning, but those specific red flags mean the doctor needs to visually check the physical structure, the size, the shape, or look for cysts, blockages, and scarring. If you don't have those red flags, you probably don't need the scan. All right, get ready for the best news in Section 4. The 3 treatment pillars, your active kidney protectors. This is seriously the most empowering part of our whole explainer today. Modern management has changed so much, and we now actively protect kidneys using 3 main groups of medications. Pillar 1, ACE inhibitors or ARBs. Pillar 2, SGLT2 inhibitors. And Pillar 3, statins. These aren't just background drugs for blood pressure or cholesterol. They are active, targeted protectors for your kidneys and your heart. Let's break them down. Pillar 1 is ACE inhibitors, or their close cousins, ARBs. You might already know these as blood pressure meds, but in the context of CKD, they do something incredibly specific. They literally reduce the pressure inside the tiny filtering units of your kidneys. By lowering that intrarenal pressure, they reduce protein leakage and physically slow down kidney damage, totally independent of their overall blood pressure lowering effect. Doctors usually start these when your ACR, urine test, shows a leak. Now, just a quick heads up for your peace of mind. Once you start, your doctor is going to recheck your blood work in about 1 to 2 weeks. They just want to make sure your potassium isn't spiking and check your creatinine levels. A tiny rise in creatinine is totally expected, but they'll tweak the dose if it jumps up on more than 30% from your baseline. Then we have pillar 2. And wow, SGLT2 inhibitors are genuinely one of the biggest shifts in kidney medicine we've seen recently. Absolute game changers. Originally, these were developed purely as diabetes drugs, but the data showed they do an incredible job of protecting kidney function and massively lowering the risk of ever progressing to dialysis. They're so good that they are now considered core treatment not just for diabetic CKD, but for many non-diabetic kidney patients who have significant protein in their urine. But there is one thing you definitely need to know so you don't panic. When you first start an SGLT2 inhibitor, a small initial dip in your eGFR blood test is completely expected. Seriously, it's totally normal. It usually stabilizes pretty quickly, and your doctor will simply recheck your levels about a month after you start to make sure everything is settling down perfectly. And pillar 3, statins. Now you might be thinking, wait, why am I taking a cholesterol drug for my kidneys? Well, having CKD is actually considered a significant independent risk factor for cardiovascular disease, meaning heart attacks and strokes. That's true no matter what your baseline cholesterol levels are doing. Because of this, statins like atorvastatin are highly recommended to give you that crucial cardiovascular protection. Protecting your heart is a massive part of protecting you as a kidney patient. And that brings us to section 5, monitoring your health, what we check and why. Understanding what actually happens at your routine doctor's appointments is huge for reducing anxiety. So here's a general roadmap of what to expect. For your eGFR and ACR tests, checking the filters and the leaks. If your CKD is mild and stable, you might just do this once a year. If it's more advanced, you'll go in more frequently. If you start an ACE inhibitor or an ARB, remember, expect a blood test 1 to 2 weeks later to check those potassium levels. And if you start an SGLT2 inhibitor to slow the progression of CKD, they'll recheck your eGFR in about a month to make sure that temporary dip we talked about has stabilized. The whole point here is just for your doctor to ensure your kidney function is stable, your leaks are improving, and your electrolytes are safe. Now, please keep this in mind. It's so easy to stress over one bad test result, but there are everyday things that can temporarily mess with your kidney numbers, totally independent of true long-term kidney damage. Dehydration is a big one. Certain medications like NSAID painkillers or just having an acute illness like a nasty bug can all temporarily skew your results. That is exactly why doctors look for long-term trends instead of panicking over one isolated blood test. They'll often just rerun the test before making any big treatment decisions. So what does this all mean for you? It means early detection and modern treatments genuinely change outcomes. Yes, early CKD is a completely silent condition, but you are not powerless. The combination of those two simple tests, the eGFR blood test and the ACR urine test, plus those 3 powerful medication pillars, gives you immense control over your future. You absolutely have the tools and treatments available to protect your kidneys. So I've got to leave you with a couple of really vital questions. Do you know your kidney numbers? And when was your last ACR urine test? If you have any of those risk factors we talked about, diabetes, high blood pressure, a history of heart disease, or a family history, please be proactive. Call your GP and ask for these specific tests. It's simple, it's highly effective, and honestly, catching it early could completely change your life. Thanks so much for hanging out with me for this explainer, and here's to your empowered health.